Okay, so I have looked at the medical chart for this patient, and she has a Foley catheter, indwelling catheter that is ordered. So we're gonna go ahead and place that. We're gonna go ahead and enter the room now. Hi, Miss Jones. My name is McKenna. I'm your nurse today. I'm gonna go ahead and insert a catheter. Before I did all this, I would shut the door behind me for privacy. Do you have any allergies to latex or iodine? No? Awesome. Okay, so I'm gonna go ahead and perform hand hygiene, and then we'll go ahead and put on some gloves. And I would raise the bed to a comfortable working height and make sure I put her in a dorsal recumbent position. I'm gonna check her ID band, make sure it matches her medical chart, and it does. So we're gonna go ahead and perform some peri-care on her. And we're gonna put a waterproof pad down. And then we'll go ahead, and I would also make sure that I'm doing this with proper lighting. We're gonna go ahead and wipe from out to in, so we're gonna start on the outside here. Go on the other side. And then we'll go straight down the middle. All right. So then we're gonna go ahead and drape the patient. I'm gonna go ahead and remove my gloves, and I'm gonna perform hand hygiene again. And we're gonna go ahead and open our sterile tray. I'm going to go ahead and open away from me. Making sure to not contaminate the sterile field. We're going to go ahead and put on our sterile gloves. Okay, we're going to start with the right hand. And then go ahead and grab the cuff of the other one. Okay, well, I think this is about as good as we're gonna get it. Okay, I ripped my glove. My gloves are too small. So I would go ahead and start over and get a new sterile tray. we're gonna move over and we're gonna go ahead and drape the patient, making sure I keep my arms above my waist. And we'll go ahead and use this other drape. Okay. And then I'm going to go ahead and open all of my supplies. Okay. I'm going to go ahead and insert the catheter into my lubricant. At this time, I'd also make sure that my drainage bag is closed. Put that about 1 inch in. And then I'm gonna go ahead and hook my saline to the catheter. Okay. And then I'm gonna go ahead and open this up. Okay, so now I'm going to go ahead and move this over to my sterile field. Alright, and then I'd go ahead and I would take one of these alcohol swabs at a time, and then we're going to go ahead and clean the patient. We'll start from outside and work our way in. So we're gonna go outside, and then we'll do the inner part. And at this time, I'm gonna use my non-dominant hand to spread her labia, and so that hand is now contaminated. Okay, so I'm gonna go ahead and insert this catheter now. I just asked the patient to take some nice deep breaths for me. So we're gonna go ahead and insert this now, about 2 to 3 inches, and then wait for urine, and then I'd go about 2 to 3 more inches. Okay, and now I'm gonna take my dominant hand and I'm going to inflate the balloon. Okay, and then I'm gonna undo it. And then I would tug on the catheter to see if there's resistance, make sure it's in there properly. And then I'm gonna go ahead and clean up everything. So now I'm going to, I would clean her perineal area if it was necessary, make sure we leave her clean. I'm going to go ahead and remove these gloves now. I would perform PPE again, or hand hygiene again, and I'll put some gloves on. At this time, I'd also collect a urine sample if it was indicated, and it is not. So at this time I'd go ahead and secure her catheter to her thigh. So we do it just like this. And then I would go ahead and take her catheter tubing and put it right into the Velcro. And then I'm gonna go ahead and hang her drainage bag on the bed frame, making sure that it is downward of the flow. Okay. And then I go ahead and clean her up. I'd also make sure that I label her catheter bag with the stickers, so date, time, and initials. Go ahead and make sure I leave her in a comfortable position. Lower the bed. And then I would remove my gloves, perform hand hygiene, and then go document.